things I want to say before we get started is just the fact that I don't know if any of you got to chance to go down to the Urban League Family Day last Saturday, but again, you know, the Urban League, Miss Linda Anderson and her team put together really a beautiful event. Lots of vendors, lots of people. I was just talking to Glam Life just a few minutes ago, just about how the young people were out, the music, and it was just really good to be able to see people and actually, to be honest, just to hug people, and so many people that you see that you just miss. So it's always good to have an in-person event, even though we are dealing with, you know, a different situation now than we were in the past as far as COVID. So I just want to give a big shout out to the Urban League and Miss Linda for putting that event on. If you were able to go, you know exactly what I'm talking about today, Minneapolis, and really wanted to kind of shift into that, right? Because I think today's show kind of goes into some things I think that we want to kind of discuss, right? And it's been a long time, Minneapolis, since we've had a really a full show dedicated to the COVID-19 updates and vaccinations and the things that are going on with the Delta variant. And the reason that I wanted to do this show today is because as we look on the calendar and we look at the clock, we see what's coming up, right? And that coming up is Labor Day. And every year, everywhere around most of the country, that means the beginning of school. So that means the beginning of school for our younger babies, our middle babies, and our older babies going back to school. And really, what does that mean with the Delta variant that's happening? A lot of us are sending our kids back to some type of in-person version, whether it's full in-person, whether it's a modification of in-person, but most of us are sending our babies back to school. So this show kind of is specifically geared toward the information that we can give you as far as what that looks like for your young people going back to school. And I've got a guest who's been on our show before to talk about that from the health department. I'll give her full introduction as we get going, but I just want to kind of give Minneapolis some numbers here, right? So I'll break it down like this, right? So as of August 23rd, in the state of Minnesota, or the city of Minneapolis, 88% of people 15 and older have received at least one shot, right? Statewide, we're at almost 71% of people having their first shot. Now, still, there is some significant disparities by race, right? So understand that. So Minneapolis, check this out. In Minnesota, 53%, 55%, and almost 72% or 62% of American Indian, Black, and Hispanics residents have at least one dose, compared to 65% of whites and 77% of Pacific Islanders. So those disparities are true, Minneapolis. So our folks of color, we're behind in getting the vaccine, and we've talked about this before, right? I have preached and I have said that I want this to be a personal decision on whether or not you get the vaccine or not. But I want to make sure that we understand those numbers, that folks of color in this city are behind in getting vaccinated, right? And the Delta variant has brought on significant cases of COVID-19, and all of the 99% of new cases in Region 5, which is in Minnesota, 99% of those cases are currently responsible. The Delta variant is responsible for those new COVID numbers. So again, Minneapolis, I want to kind of just set the tone here for the conversation about this show, right? We have seen about the restrictions that are in place. We are seeing statewide as well as national, a lot more requirements of folks having to be vaccinated. So if you look at how you get your news, or you look at how you get your information, there's a lot more people requiring vaccinations. There's a lot more people, a lot more businesses requiring vaccinations to go to work, and mask mandates, or even being able to check to see if your temperature is where it's supposed to be. So I want to make sure that I kind of set the table for this conversation, and understanding that school is right around the corner, right? So what I want to do today, Minneapolis, is bring on a really good friend of the city, a really good friend of the Minneapolis Health Department, Louisa, to come on and talk about COVID-19 vaccinations, updates, and Minneapolis, some incentives that are given out for folks who want to take these vaccinations. So again, Louisa, welcome back to the program. How are you doing today?
I am doing well, Anthony. Thank you for having me.
It is always my pleasure. Yes, I can. Can you hear me?
Yes. Just wanted to make sure.
Yep, we're good. And I thank you for coming on, because I think it's important that we start to talk about this Delta variant, right, and what's going on. So I want to just give you the floor, right, and just share with us, like, what is going on with this vaccine. The spread of the Delta has brought on a lot of different things, and especially with children who weren't eligible for the COVID-19 vaccination last school year. What's different now, Louisa, from this situation last year?
Sure. So a couple of things. One, we, compared to last year, the start of school, we had no COVID vaccine for anyone, really. And now we have a vaccine that's approved for use for anyone 12 and older. The Pfizer vaccine has an emergency authorization approval for 12 to 15-year-olds, and then it has, is just on Monday just fully approved for use for 16 and older. So we have a proportion of kids that are going back to school that can be vaccinated. Those between 12 and 18 are eligible to be vaccinated. Unfortunately, we don't yet have a vaccine for those younger than 12, but that is in the works, and we'll hopefully have something before the end of the year. But right now, anyone 12 and older could be vaccinated prior to returning to school. In terms of the Delta variant, what we're seeing is it is viruses mutate and variant. That is a normal thing that happens with any virus, and so the Delta variant is a variant of the COVID virus that we've been dealing with for the last year and a half. Unfortunately, this variant is much more transmissible. So where with the original virus, a person that's infected could maybe infect 3 other people, with the Delta variant, a person that is infected can infect up to 7 other people. That's sort of what the research has shown, and so it's much more transmissible. And but the good news is the vaccine is still effective in protecting you from getting that infection. And if you are one of the less than 1% of people that are vaccinated that get the infection, you are much less likely to end up needing to be hospitalized or having severe disease. Unfortunately, because our kids cannot be vaccinated, we are seeing an increase in the numbers of kids that are testing positive, given that there's more virus, again, circulating in the community, and it is a virus that is more transmissible.
And thank you for bringing that up. And I want to just kind of backtrack what you said. And I know this show is really focused for our young babies, and we're talking about back to school. So one of the things that I heard you say is, and I think a lot of people who've been kind of tracking this Delta variant, is that, okay, this variant is definitely more transmissible, right, than before. And just talk a little bit about, okay, so some cases of folks, and we've been hearing folks who have been vaccinated for COVID, still getting COVID again. Louisa, is this, how does this happen? Can you kind of explain that to folks? Because I think it may help with some of the vaccine hesitancy.
Yeah, so no vaccine is ever 100% in terms of keeping you from getting the infection. And so, even when Pfizer and Moderna and Johnson & Johnson initially came out, really what they were saying is they were 95% effective at keeping you from getting severe disease and getting into the hospital. We also saw that before the Delta variant, it was fairly effective as, if you were exposed, not getting the infection. Now, what we're seeing is because, one, the Delta variant is more transmissible, that some folks who are fully vaccinated will still become infected. But we're not seeing those folks ending up in the hospital at as high rates as those that aren't vaccinated, or, the same thing with deaths. And it's still a fairly rare occurrence. So, when we look at the data for Minnesota, less than 1% of those that have been vaccinated have tested positive for COVID. It's actually something like 0.3% of fully vaccinated people have tested positive for COVID after being fully vaccinated. So it's a very small number, it's a very small percentage of people. It doesn't, I'm sure it doesn't feel that helpful for someone who was fully vaccinated and then tests positive. But this is, the more people are vaccinated, the less transmission will occur, and the less likely we are to, the more likely we are to see a decrease in cases. And so it's just, vaccination is the best protection against the infection for those that can get vaccinated.
And I'm glad you said that. And the reason why I bring that up, a lot of times folks don't have access to this data that the health department has, right? And so we hear and we see stories about this. So I wanted to make sure that at least that was addressed before we move forward, Louisa. So I thank you for even answering that question. So, give Minneapolis the reason why our babies should be vaccinated.
So, like I said, we are seeing an increase in cases in Minneapolis. The majority of cases that we're seeing are among those folks that have not been vaccinated. We have been doing a great job of trying to get people vaccinated, but we are still continuing to see some disparities. And unfortunately, the communities that have lower vaccination rates are also the communities that have been the most impacted by COVID-19. And so, do it for yourself because it protects you from severe disease, but do it for your kids, for those that can't be vaccinated because of their age, because there's not a vaccine for them, or because they have some health condition that doesn't allow them, that prevents them from being vaccinated, or they've been vaccinated, but because they have an immunocompromising condition, they also don't have as good of protection from the vaccine as you and I might have. So, it's really about doing something for doing it for yourself, but also for the rest of the community, because by getting vaccinated, you protect yourself, but you also are protecting others. And it really is the only way that we're going to get out of this pandemic is by getting as many people as we can vaccinated and doing it for all of the communities.
And as we know, Minneapolis Public School is not requiring vaccinations. Is that correct?
For COVID, at this time, there isn't any school that, it's not a requirement in the state. And so there's a process that vaccines go through to be, for it to be, required as a school vaccine. And as I said, at this point, the vaccine is only really available for those 12 and older. I know that the Minneapolis Public Schools, along with the city, are going to be hosting a couple of vaccination clinics in back-to-school nights, and they've been encouraging staff to be vaccinated, and so I think while it's not required, it's definitely encouraged, and they have both the schools and the city have been working to make it accessible to people to get vaccinated.
And school is coming up.
There's some incentives to get vaccinated.
And absolutely. So let's transition to that, Louisa. A lot of incentives for folks to get the vaccine. We know that at least there's a kind of breaking news update around what the state fair is doing. So kind of tell us about some of those incentives for people who have not gotten their COVID-19 vaccinations.
Sure. So Hennepin County is offering vaccine incentives to people 12 and older that get their first or second shot. So any clinic, Hennepin County clinic, you can find a list of those on the Hennepin County website, and they're open to anyone. And so anyone 12 and older will get a $50 gift card, Visa gift card, for the first shot and for the second, and for the second shot. So that's one incentive that's happening. And the state just announced that for those people that are going to the state fair, so you do have to be going to the state fair and have a ticket to get into the state fair, but they're going to be hosting community vaccination clinics there, and those that get their first shot at that community clinic will be eligible for a $100 incentive card. So, there's some other pieces around how many people will be able to get it, and but anyone over 12 will be eligible for that $100 gift card. I think it's the first 3,600 people that get it will get it on site, and then I think the rest will be able to claim them via the state's website. But so a couple of places where you can get incentives for getting that initial shot, and then with Hennepin County, you get $50 for each of the shots, so first and second dose.
Yeah, and I think that's important to know, Minneapolis. And also, if you want more information, there's a COVID Navigator line at 612-348-8900. And if you're planning on going to the state fair, and I think there's a lot of decisions folks have to make around that, right? And we understand that. But if you are going, you're able to get that $100 Visa gift card on site for those first 3,600 folks. So that may be able to help kind of ease the pockets a little bit when we're talking about spending money buying the corn and the Martha's cookies and everything else in Minneapolis. We just want to make sure that we get that information. Can you tell parents where they can go get the Pfizer vaccine, Louisa, for children over 12?
Sure. There's, there are some community clinics, and the city Minneapolis website, minneapolismn.gov, has information on clinics that are happening. There is also Mall of America community vaccination site, and you can find details of those at the mn.gov/COVID-19 website. And I believe there, you can also get information from the Hennepin County number that Anthony, you just said, would also be able to provide you that information. But the other option is if you are taking your kid in for their physical before the start of school, that's a good opportunity to talk to their healthcare provider as well and get the vaccine. So there's plenty of vaccine available. We are not in a situation like we were at the very beginning of this where we didn't have enough vaccine. There's plenty of vaccine for anyone that wants to get vaccinated.
And I appreciate you saying that, because we're in a different space right now. Obviously, we are almost a year almost in the fact that the vaccine has been available from, emergency authorization usage to now where we had a short supply. We went through phases. Now there's plenty of vaccine to go around. And I just want to give folks that information again about vaccines for parents to go to get the Pfizer vaccine. Again, it's minneapolismn.gov. Also, too, the Mall of America vaccination site, mn.gov/COVID. There's also the COVID Navigator line at 612-348-8900. And Louisa, real quick, is it too late to get fully vaccinated before school begins?
Well, it is. It's too late to get fully vaccinated before school begins because of the process. With the Pfizer vaccine, you get an initial dose, then you get a second dose 3 weeks later, and then you're fully vaccinated 2 weeks later. But what has been shown is that even one dose of the vaccine offers some protection. So, parents can go get the vaccine today or tomorrow for their kids. They would be then getting a second shot 3 weeks later. So, I think that would be around if they went today, that would be the 15th. If they went tomorrow, it would be the 16th. And then their kids would be fully vaccinated 2 weeks later, which would be the end of September, early October. Now, yes, it's not the beginning of school, but it's fairly close to that, and getting at least, it's for Minneapolis Public Schools. School doesn't start for a couple more weeks, so at least if you get the vaccine now, there is already some protection that begins for those kids that are 12 and older. And so completely encourage parents to do that, even as you are maybe, catching up on the other vaccinations that your kids might need for going back to school. If they're 12 and older, there are some vaccinations that are required in terms of going back to school. And so if you're, already taking them in to do that, getting the COVID vaccine is another opportunity. At this time, there isn't any contraindication to getting the COVID vaccine at the same time that you're getting other vaccines.
We are with Louisa from the Health Department, Minneapolis Health Department, talking about COVID-19 vaccinations and updates. So, Louisa, kind of give us a rundown quick. Like when we're talking about this time of year with school, we're talking about a lot of vaccinations that children need before school. Just kind of walk through us here quickly some of the other vaccinations that's needed before kids start back to school.
So there are some for kids that are entering early childhood and child programs and child care. So those, the birth to 4 years old, hepatitis, the Tdap or DTaP, the diphtheria, tetanus, and pertussis, polio, the MMR, and a couple of other ones. For those entering kindergarten, hepatitis B, again, the tetanus, the DTaP, polio shot, and MMR and varicella are among those. And then for some of the older kids, you add in the meningococcal vaccine, as well as some boosters for the ones that we mentioned. There's a lot of vaccines, and the best way is to go to the health section of the Minneapolis Public Schools website. They have a good list of information of what is required and what is needed. And that website is health.mpls.k12.mn.us. Or, just type in Minneapolis Public Schools on Google and then go to their website and to the health portion of it. And they will be able to, it will list what is necessary, because there's quite a few different, depending on the age and what grade they're entering, what the requirements are.
And that's good information, and I appreciate you coming today, Louise. I think the last time you were here, you provided a lot of great information as well. So, again, I think this is important, and I'm glad you're able to talk about that, because, the clock is ticking and things change, as we get to Labor Day, because to me, that always means school is starting. So I appreciate you coming on today, and thank you so much for being a part of the show.
Yeah, no problem. Happy to be here. I just as a sort of ending, I want to make sure that people, COVID is still with us, unfortunately. I think many of us would have hoped that it would be gone. I think it's important for people to think about, if you develop symptoms, getting tested, getting information, and get yourself, if you haven't had the vaccine, go out, get that vaccine. It helps. It will protect you, and it will also protect your community. So that's sort of just in closing. That would be my message, and hope everybody has a rest of a good summer, and that we can get kids in school and stay in school and move on from this pandemic.
Thank you.
Absolutely. Thank you, Louisa.
Okay, thank you, and have a great day.
You too.
Yes. Yep. Kim, they're giving out incentives, right? So,
I've been sending gift cards. I've been getting emails, the text messages.
Hey, that $100, you can do a lot of different things. You can do whatever you want to do with it. It's not cash, folks, but it's still as good as cash. So
it is. There's something I wanted to tell the listening audience too, Anthony, and I've heard this from quite a few people. So, hey, it could help somebody else to maybe, determine whether or not they want to get the vaccination. But, there is a 34% 64-year-old black woman that she is a key scientist behind the Moderna vaccine. And yes, she's from North Carolina. Looks like me. I mean, she changes her hair, her wigs, and everything else out like I do. But I know that sometimes, it helps, and she stands behind that product. And sometimes, it just helps to know that there's somebody else. Her goal, even with being a scientist, is to help bridge that gap, between just to build the trust back with the scientists and, with medicine, right? Because we've been stripped from, so many different things that, centuries ago. So, hey, do some research on it. Her name is Dr. Kizzmekia Corbett. And, just in case, if it helps you to feel a little bit more confident about getting vaccinated, whatever works for you.
And I appreciate you putting that in the space, because you are absolutely right. We have a distrust on science, scientists, medical as a people, right? Just
Right.
the things that have happened to us, and then we're talking about vaccines, and we've talked about this extensively throughout the year with COVID. So we know the hesitation, right? So, and I'm glad you
Threw
did
that
that
out
in
there.
this. Absolutely, because if this sister can help you make an informed decision, then that's what we really want to happen, right?
Absolutely.
So, absolutely. And I know we're out of time. We're up against the clock, Kim. It's always a pleasure to be with you and hear your voice, sis.
Same here.
Have a blessed day to you in Minneapolis, and everybody be well and be safe.
All right, bro. You do the same. Twin
Thank
Cities.
you.
Thank you. Twin Cities right now, we've got Zany K, Mr. Loudmouth himself. He's going to put you up on game.